Hi everyone, welcome to our Instagram Live. My name is Ashley Aldridge. I'm a PA here at Boyd and a Sculptra enthusiast, and I'm here with our esteemed medical director, Charles Boyd, double certified, board certified plastic surgeon, and we're here today to talk to you all about weight loss and lipoatrophy of the face, aka Ozempic face. So, Dr. Boyd, tell me a little bit, how long have you been treating weight loss patients with these products?
Yeah, it's interesting. So all the new GLP-1 agonists, we call them, so those are the injectable or the medical weight loss drugs, and now oral, I guess we could say. There are now 22 million Americans on these medications, and it's presumed that about 1 in 8 will be on it soon. So that's a big rush, but many of us, like you, Ashley, have been treating weight loss and extreme weight loss for many, many years. In fact, what a lot of people don't realize is that that was really one of the original indications for Sculptra. So way back in, I'm dating myself, but probably 2007, 2009.
That's a good year.
Yeah. Even before that, actually.
Yeah.
97, maybe. Yeah, 97. I'm really dating myself. Yeah.
Absolutely, and we're seeing an influx now of patients that are on these GLP-1 medications, and they're noticing changes in their skin and in the volume in their face. So can you talk to us a little bit about whether or not these patients should be waiting until they've reached their weight loss goal in order to come in and see us in order to develop treatment plans to treat that laxity? Or is it better that they be treated at the same time? And is there a study that talks about this?
Yeah, I think that's a great question. I think there was initially some uncertainty about that, but now that's been pretty much cleared up. So, Dermal, who was the maker of Sculptra, recently did a study and actually just happened to present on this data where they looked at, it was at 2 different sites, and they took patients that were on GLP-1s and actively losing weight. And the question was, can they be treated, and can they be treated successfully, and are they happy with the treatment? I think before that, there was some question really about if you're actively losing weight, will these products work? And so Sculptra, as we know, is a biostimulator, so it's stimulating collagen and now elastin production. And so that's great for all of us, whether we're losing weight or not. But you actually can be treated while you're actively on these medications. And I think that's really the best way to go, because what the study also showed is that patients knew they wanted their body to lose weight. They wanted to be kind of a healthier body, but they didn't realize the effects it had on their face.
Absolutely. And is there a general rule of thumb that you have, or the study kind of demonstrated, where if you lose 10 pounds, you need 1 vial, 20 pounds, 2 vials, etc.?
Yeah, I mean, Ashley, and Ashley's a very experienced Sculptra injector and trainer, and I think that we have some guidelines that we generally use for Sculptra in terms of weight loss and the number, but I think medicine is as much art and science as science, and that's one of the things that I love about the field, and I know we love about the field. And so I think we have the ability to tailor it to you, because one of the things that we all do with time is we lose weight in our face, or our faces get thinner, and because that occurs slowly, we don't really realize it. And so if we were to just restore someone's face to how they looked when they were 20, most people would think they were overfilled, when actually they're not. But that's why we can do that slowly, and Sculptra is really so good at doing that, because it's a slow process that builds up a little bit over time.
Absolutely, and that is why we love Sculptra. And I understand in the study, they also were able to use some dermal filler as well at the same time that they were receiving Sculptra. And I feel like a lot of patients don't realize that this is an option. I usually describe Sculptra as like the 401k for your face, and fillers like the payday. So that way you can benefit from both products. Can you talk a little bit about which fillers were used where, and where they could benefit from that?
Yeah, I think that's the beauty of this particular study, and Galderma has a combination of Sculptra and two of their HA fillers. So one of which is Contour, the other is Lift, and those are both great products for the mid-face. And they work a little differently, as you know, and so the Contour I like to describe as I look at patients if they have lost a little volume loss in their cheeks and they have a nice rounded cheek, it's like a dome, you know. So when you put that product in, it's like a soft filling of that face. The Lift is one of the products that has, just as the name says, the highest or the most lift. So I tend to use that patient that have had either more sagging in their skin, or if they have a little bit thicker skin, I need a more robust product. But as you were mentioning, the beauty is that you get the best of both worlds. You get the immediate lift and the immediate results, and Sculptra is that long-term, over time product that works so well.
Absolutely. And I think that it's important to note that what makes us different here at Boyd is we can put together a comprehensive treatment plan for you. And we also use the state-of-the-art technology and skin tightening devices as well as collagen stimulation treatments like microneedling, radiofrequency microneedling. Can you talk to our patients a little bit about what devices we have here that may also help aid in combating that laxity?
Yeah, you know, that's, I think, from the inception of Boyd and having the amazing providers that we have, we've always, I've always tried to be at the cutting edge of technology and research, and that's really why we do a lot of research studies here. And so we know that, I say we age all over our face and body, and we should talk about body treatments as well, because there is an Ozempic butt as well, not just face.
We did get a question about Ozempic butt, we did.
So I think one of the beauty is that, we know that, and there's more and more research around it, but we know that not only are we losing weight, but we're losing the deeper facial fat pads. We also see a lot of skin changes with people with rapid and massive weight loss. And we think some of those skin changes actually have to do with some of the hormones that are actually in the fat cells in our skin. And so when those are reduced, the skin quality can also be reduced. So having treatments and having options to holistically treat our patients is really one of the unique things that we offer.
Absolutely. And the patients that were in the study, I understand they were followed for 9 months, but can patients expect to see long-term improvement with biostimulators such as Sculptra?
Yeah, Sculptra is one of the longest lasting products. We know well over 2 years it affects last, and I generally say I see patients over 5 years with these same effects of Sculptra. And I think one of the things I love about Sculptra, I would say that, if your patients that are on Sculptra look better, so they always look better, but they don't always look different. And so that's one of the things that's beautiful about it, is that, a lot of patients come in, they're like, well, I can always tell when someone's been on or has had fillers. And I generally say, we can tell when they've had bad fillers, but when it's done well and right, they just look better.
For sure, absolutely. And can you talk a little bit about utilizing maybe Ulthera?
Yeah, we're talking about energy-based device. Yeah.
Energy-based devices at the same time as Sculptra? Is that something that you would recommend?
Yeah, I think they're complementary. Ashley, I know that you have a lot of patients you treat as well. And so some of the energy-based devices we have, they work underneath the skin, so they're heating the collagen. They're building something called matrix metalloproteinases. And so that is exactly what Sculptra is doing. It's building collagen in our skin. So they're really complementary. So you want to do things that are tightening the skin on the inside and on the outside. You talk about microneedling with radiofrequency. That's also skin tightening as well. We have a bunch of lasers that also are helpful. And I think it's pretty remarkable the things that we can do to rejuvenate a face. I often now, pull up, I have patients that I've been treating for 12, 15, 17 years, and some of them actually look younger now than they did 10, 12, 17 years ago. And that's really remarkable.
I agree. And I agree that multimodality treatments are really the key to success when it comes to combating these facial changes that we're seeing with these GLP-1 medications. And I think that you really need to come in and have a full consultation so that way we can put together a comprehensive treatment plan, because I kind of describe soft wave oral therapy like kind of supercharging your collagen stimulation when we're using a biostimulator such as Sculptra. And I think that it's ideal that you would come in and put together a full treatment plan, not just for the face, but also for the body. We did have some questions about knees and elbows. So can we use these same products and devices to treat those areas?
Yeah, so you absolutely can. We do that all the time. You know, most of us don't love our knees, so they can get a little wrinkly and lose volume, and just like laxity in the skin and body in general. But we've actually treated all over the body with Sculptra, so knees, elbows, abdomen, chest, décolleté, neck, obviously face, you know, buttocks, BBL, Sculptra BBL is a big thing. So even kind of dimpling and tightening of the skin and the thighs. So Sculptra is really versatile. So these biostimulatory products, that's really the next wave in terms of rejuvenation, I believe. And so we've always been at the cutting edge of that, and I know that you're a big proponent of that, and so yeah, I think you do the same thing, right?
Absolutely, yeah. I think that that's what I love the most, is putting together like a full plan for our patients. So I think that it's essential that if you're on these medications to not wait until you've lost all the weight and met your goal. You really want to come in and get ahead of that, so that way we can treat your skin, so that way the skin doesn't suffer from these changes as you're depleting those fat stores in the face.
Yeah, I think that's interesting. I was listening to a podcast just this week, and it was really talking about secrets that people have, and it wasn't just about medicine, but one of the things it said is, I think it was, the number was like incredibly high, like 80% of patients or people lie to their physician. And you know, his premise was, it makes no sense, right? Your physician is there to help you and to make you well, and so, but many times patients come in and they don't say that they're on GLP-1s. I mean, we can tell generally, but I think so. It's important to talk to your aesthetic provider. It's also important, if you're thinking about getting on those medications, to talk to us at that point. And the beauty at our offices now here is that we actually provide those medications, so they can do both. We have providers that specifically do that, and then you have providers like Ashley and myself that kind of help on the cosmetic end. That statistic from the paper and the study, but they estimate, again, 22 million people are on GLP-1s, but only 500,000 are actually getting the aesthetic treatments concurrently. And one of the things the study also revealed is that most patients don't realize the facial changes that they will undergo with the weight loss. And so they didn't expect Ozempic face when they got their Ozempic body.
Absolutely, that was a question someone asked our Instagram, what areas of the face do we commonly see when we're describing Ozempic face? So that would be hollow temples, kind of a sunken cheek, we call the submalar area, so kind of more the lateral portion of the face. I do want to mention the neck as well, because we have a lot of questions about the neck. So the neck is a very special area because of its thin dermis and the lack of sebaceous glands. So the neck needs a very specialized care plan, and we have the top experts here where we can safely treat your neck in order to help combat some of those changes. We have a lot of exciting things with microneedling. Do you want to talk a little bit about acorns as well to our patients?
Yeah, so again, we're talking about rejuvenation. Some of the things we offer, you know, I love research in that particular area. Acorn Labs is a product where I had a meeting with the founder and CEO of the company here about a year ago. But they're based in Canada, but they basically take hair follicles. So patient will come in, I've had it done, you've had it done. So you take a few hair follicles, and they then take those hair follicles and they produce your body's own, basically like stem cells. They call them secretomes, and they are like your body's natural stem cells. And then you will get a kit that is your customized product that you can then use after microneedling. Some people use it in hair, people use it in different after laser procedures, and so I think it's a great product, and more products that we have like PDGF, PRP, PRF, these are all some of the growth factors and regenerative treatments that are super popular right now. The peptides and all of those things are the rave, and so we're always on the cutting edge of that.
Absolutely, that's very exciting. Very holistic treatment plan for the entire face and body. I think those growth factors are amazing for the neck as well because the skin is so delicate.
Yeah.
It's almost as delicate as the under eye area.
Yes.
So if you have questions about your neck, feel free to ask them below in the question box. Also, we're keeping track of all the questions that you guys have. If we don't get to your question during the live, go ahead and send us a DM and we'll make sure to answer that for you before the end of the live. I did have a few questions, like filler phobic questions.
Yeah.
So a lot of patients are worried they've worked so hard to lose the weight and now the idea of putting volume back in their face is scary to them. So any words of advice you have in order to help with that?
Yeah, I think that it's not really, I think filler certainly had a bad rap in 2025. And I think that everyone saw a celebrity that had bad filler, and I generally tell patients that it's probably and typically not filler that you're seeing where you see people with these bloated, distended faces, because all of the hyaluronic acid fillers, which make up over 90% of the market, are 100% reversible. So you can give a patient an injection and it completely dissolves. And so I see filler as the opposite. I see it as one of the safest aesthetic products there is. But we also know that if you had no volume in your face, you would look like a very skeletonized face. And I always say that when I first started my surgical training, it's funny because every patient that came into our office got cut, because we didn't have Botox and fillers like we do now. But those were the days when you would see patients, they would have a facelift, but it looked like very tight skin pulled on a skeleton. So their skin was tight, but they didn't look younger. And it wasn't until we learned to restore the volume and the fat and the structures, the deep fat pads of the face, that patients actually look younger. So now, everyone is now trending back on facelifts, but even with facelifts, we're often adding volume back to these faces.
Absolutely, and that's why I got started with Sculptra. It was such a great product to use post facelift because you pull them very tight and they still have volume loss in the lateral face. So I like to reframe filler as we're giving you contour and definition. So contouring the cheekbone, defining the jawline. We're not filling you.
Yeah, filler's a misnomer.
Yeah, for sure. I like to say people view it as like an F word, but I think filler is, F is for fun. Filler is fun. We love filler, but when you've lost a significant amount of volume in the face, one syringe of filler is equal to about 1/5 of a teaspoon.
Yeah.
So you really
about
need
the size of your fingernail.
I love that. Yeah. So you really will need multiple sessions with fillers and biostimulators potentially in order to give your face that beautiful natural contour and maintain also the skin integrity. That's extremely important as well. So
I would say one question I get often is, so patients have either read or seen on Dr. Google or Dr. Instagram that
your favorite.
if they've had Sculptra, they can't have a facelift. So that's 100% not true. So I treat patients all the time. I do surgery and facelifts on patients that have had Sculptra, and so 100% will not negatively affect your ability to get a facelift. In fact, many times it helps them because it truly can thicken the epidermis, the surface of the skin. And so those patients, a patient with thinner, younger, more elastin in the skin will do better in the long term with a facelift. The hardest patients are patients that we have what we call solar elastosis, and so that's when the skin looks like it's just draping and falling off. And so you can cut all that skin off, but the sagging returns. So you need that integrity that these products can give.
Absolutely. Thank you for saying that. And I think it's important to note that Sculptra is not a new product, and it's very rare that a virgin face comes to you for a facelift, right? So,
Yeah.
but the better your skin quality is, the better your outcome will be, regardless of the procedure that you're having done. And I think it's also important for us to iterate the importance of medical grade skincare, so utilizing retinoids, using topical growth factors as well. I know that we've all been really loving plated.
Yeah.
And I think we should touch on hair loss.
Yeah.
I think that brings up another important question. So do you want to touch a little bit
Yeah.
on plated and maybe on our protocol for hair loss and what makes us different here?
Yeah, I think, getting on that same regenerative theme, Plated is a company that is actually came out of Mayo Clinic, and it's really, really science-based. And so I actually went out there and visited with the founders and was at Mayo Clinic and some of the labs. And it's a product that's really based on something called an exosome, which is a special transport cell in our bodies. And its function really is to restore us to what's called homeostasis. So it's the area that, so if you've had an issue with the body, then it can return it to its normal state. And so it's going to be used not just in skincare, but injectables. They're using it already to restore cartilage and joints in horses, and it's been FDA approved for thoroughbred horses. We hopefully soon will be humans. But they also have a topical for the skin, which is one of our favorite products.
Absolutely.
So Plated for the skin, Plated for the eyes, they have Plated for the hair. That's just an amazing, amazing product.
Absolutely. And the changes you see with hair, I would say that's a really common concern for patients. In dermatology, we term that type of hair loss telogen effluvium. So it means all of your hairs have kind of shifted to this shedding phase. We see that commonly postpartum and post really any chronic illness, stress, surgery, etc. So patients often come in feeling very alarmed at their hair loss. And I love that we have cutting edge technology and options here, such as acorns.
Yeah.
We can do PRF in the scalp in order to help stop that shedding from occurring. And then we have the incredible Plated Hair Serum also to help encourage new hair growth. So hair growth is one of the more difficult things that patients deal with, and that can be chronic as well.
It is, and we do, if I must say so ourselves, a fantastic job. It's really our estheticians really do that mostly, but we've had actually referrals from hair transplant surgeons that send their patients specifically here to get the treatment because it does a remarkable job. And so that's one of the things that, women actually, everyone associates hair loss with men, but women have, androgenic, we call it aging hair loss or androgenic hair loss, almost as much as men do. And it's actually, the stigma is actually higher in women than it is in men because we expect men to have some hair loss, and women, it's not as expected, and so it can be very traumatizing. And so having treatments for that is something very important to me.
Absolutely, I agree. And I think, do we have time for a few more questions maybe? Perfect. So we also had some questions about if patients have to have maintenance done. So if they're done losing weight, they're in their maintenance phase, what would an average kind of maintenance look like for injectables for these patients?
Yeah, I say that when you're entering your aesthetic journey, I generally say maybe the hardest part is building it up. The maintenance is a little bit easier, and I think that is very variable. We're talking about tailoring it to the person, and so everyone's a little bit different in their maintenance journey, but I think I always say maintenance is much easier than letting everything kind of go back to baseline and trying to build it back up. So, and that's how we get patients that look younger years and years and years later, is that they have a great maintenance program, and that's something that we strive to do. We're part of that aging journey with our patients, and so we're kind of your partner in that, and so that's really how we strive to be. So it's a relationship and this conversation that we have with our patient and getting that tailored program that's specifically for them. And I think that's one of the things that Ashley does so well, which is why our patients love her so much, is really that conversation that you're having with your patients.
Absolutely. I like to call myself the financial planner for your face. And the way I describe it is we want to diversify your face portfolio. So you want some in the 401k, you want some cash, some payday, and then, you know.
Payday loan.
Yeah, exactly. So I think I also describe it as like topping the gas tank off, you know, so you don't want to go back down to E.
Yeah.
You know, you want to come in and you want to do
Don't
some...
want to run out of gas.
Yeah, you want to do some yearly maintenance so that way you can maintain your results. But what's so great about biostimulators like Sculptra is they have that 2 to 3 year FDA approval. So once you're at your goal, you can go into your maintenance phase, and we're more than happy to guide you regarding that and what our recommendations would be. And then, can you talk about hands as well? Someone asked you about hands. Can you use these products in the hands?
Yeah, we always say that 2 areas you look at to know someone's age is the neck and the hands. And so those are the areas that you also want to treat, right? If we're trying to, you know, keep our age to ourselves, then the hand is a great treatment for these products. So I personally like a combination of an HA and a biostimulator in the hands. I think that works really well. It can help thicken the skin. It can help if you're someone that has a lot of veins, and it can help with that as well. And so that's a great product. We talked about the neck, we talked about the hands. We didn't really talk about the Sculptra butt, but that's another, or the Ozempic butt.
Yeah.
But that's another area that we spend a lot of effort with. And so there's a lot of different options there as well.
Absolutely. I think it's important to note about the body, the skin of the buttock and the thigh is very thick. So you may have to also incorporate radiofrequency microneedling, for example.
Yeah.
I think that's very common.
Or sometimes it's cellulite, so we have a product called Avali for that, works exceedingly well. But many times it's a combination. So many times there is, you know, true cellulite, which 85% of women will get cellulite in their lifetime. So there's treatments for cellulite, there's loose skin, and I think a good rule of thumb is which is what, which one is which. And so I would say that if you stand up and if you pull your skin like this and all the dimples go away, it's usually more loose skin, so it's a different treatment, but generally a combination is really the key. We keep harping on that, but that's the beauty of Boyd, is that we have a bunch of different combinations of treatments, energy-based, skincare, surgery, injectables, and providers that each have their own expertise. They each have their own things that they like to focus on. And like, even my question for you, like, what's your favorite thing to do right now? Actually, what's your favorite treatment?
I mean, my favorite treatment is always Sculptra, but I would say I really love right now doing those holistic, individualized treatment plans where I'm combining Sculptra and filler on the face, so that way my patients can get that immediate result that they get really excited about, but then also I'm giving them the skin results that I want. So I really love that, because the hard thing about Sculptra is you have to be patient, which I think we should also kind of emphasize. You know, it can take about 2 to 3 months to start to see a difference in that collagen stimulation, and the results from your first treatment kind of peak at about 6 months. So I describe it as like a snowball effect. So you want to come in about every 8 to 12 weeks so we can maybe add additional biostimulator if necessary, so that way then you can get this kind of snowball effect where you're creating this beautiful collagen.
Yeah, and that's one of the reasons why the combination of the protocol, the Galderma, the HIT protocol with Sculptra and the hyaluronic acid. So in the study, they actually looked at these patients. So even at 4 weeks, they saw an improvement. And again, at 9 months, 90% of the patients were happy and satisfied with their treatment. So that's a pretty amazing result.
For sure. Just to give you guys an idea of studies, for 90% of patients to be happy, that's an incredible result.
90% of anything is happy, pretty happy.
That's true, yeah. And then we had one last question where I wanted us to kind of dispelling some rumors about Sculptra, because there's some fear behind that. And then I think what makes our team so different about injecting Sculptra, utilizing biostimulators, is that we have combined like over 30 years of experience between the two of us. We're both national trainers for the company, Galderma, that makes Sculptra, and both Dr. Boyd and I have treated patients that originally had HIV and were coming in with fat loss related to their disease and treated them with Sculptra. So what can you kind of say to patients that are concerned about Sculptra, about the potential for a complication, and why are we the best at managing?
Yeah, I mean, I think first of all, it's exceedingly low, the complication rate. And
Yeah,
so
very safe.
one of the things I think about all injectables is that complications are less than 1 or 1%, so it's super, super low. But I think that's one of the reasons that if a patient gets one, it seems like so remarkable because we're not used to seeing it, where other procedures we do, it's much, much higher. But again, it's exceedingly low, and the thing you can be happy about or confident, particularly with Boyd and here with Ashley and myself and our other providers, is that we've seen them all. And again, I've done a lot of the studies, and being national trainers and key opinion leaders, many times we're the people that all over the country, people are asking us, how do you treat these complications? And so I think that that is something that we also enjoy doing. You never enjoy seeing someone that's had a problem, but we get referrals from providers from all over. I saw a patient today that had a complication that we're able to help. And so I think the message is that it's super rare, nothing I would worry about, but if you had an issue, this is the best place to be.
Absolutely. And there were no complications seen in the study
No,
that
zero.
dermal conducted, besides being happy. But I think what you can expect would be maybe some bruising and some swelling. You have to keep in mind that Sculptra is a water-based product or a suspension, so you will see a little bit of a pseudo result immediately, and then as your body absorbs that water, you'll go back to baseline. So there is a bit of a journey when you utilize those biostimulators. So that's what makes this holistic, individualized treatment plan so unique and beneficial for weight loss patients, is that you can really treat with filler and biostimulators at the same time.
Together.
Yeah, absolutely. So anything you want to say in closing?
I think that I would say I think this is an exciting time to age. We have more and more tools. I say that every year. It's more and more exciting. That's one of the things that I think got me into this field, and I love about it is the new technology, the new treatment plans, the option, and really the journey that we get to go on with our patients to make them kind of look their best, feel their best, and it's super satisfying.
Absolutely. Weight loss especially is such a personal journey, and I'm always excited to see all of you here in the office that have accomplished such an amazing goal at losing weight. And we would love to see you here in the office and help you to put together an individualized treatment plan so that we can help to preserve your facial volume and skin quality, and that way you won't have to worry about Ozempic face. So,
That's right. See you soon.
yeah, absolutely. And if you have any more questions, please send us a DM or email us at info@boydbeauty.com. Thanks so much, guys, for joining us.
Bye.
Bye.